I'm Lou Becker from Johns Hopkins University in Baltimore, Maryland. I gave a presentation at this conference on platelet function and acute ischemic outcomes in acute coronary syndrome. So I gave some aspects of the pathophysiology and pointed to the important role of platelets in precipitating coronary artery thrombosis. I talked about how antiplatelet therapy was a cornerstone of therapy in acute coronary syndromes, and indicated that aspirin is an important basis, and the addition of ADP receptor inhibitors was important. I talked about the standard therapy, clopidogrel, and the newer agents, prasugrel and ticagrelor, the last of which was just approved last year by the Food and Drug Administration. I talked about the differences in these ADP inhibitors and how the newer agents were more effective, but they caused more bleeding and sometimes fatal bleeding, and have black box warnings on their labeling. We talked about platelet function testing and whether it has a role in providing tailored therapy for patients being treated for acute coronary syndrome. Patients who have high on treatment, platelet reactivity, have worse outcomes, but it's not clear that being able to tailor therapy for this test result has any real impact in outcome. Then finally, we talked about the genetic testing for CYP2, sorry. And finally, we talked about genetic testing for CYP2C19 variants. We talked about how earlier studies were quite strong in showing that having a loss of function variant was associated with worse outcomes on clopidogrel, but that newer meta-analyses in the past year, with including 20,000 to 40,000 patients, have not supported the earlier studies, so it is still not clear whether or not genetic testing of CYP2C19 is warranted and should be part of general practice.